started black. Black prophet, that's a fact. Going down in history and it's a fact. It's a deadly combo, niggas know that. Prophet, that's a fact. Black prophet from the bottom of the map. Atlanta, Georgia to Florida. We up in them waters, it's on, bro. Black prophet.
Welcome, guys. We are back.
Hey, good evening, everybody.
Hi, everyone. It's good to be back, even though we're here quarantined in our houses. I missed you, but we have a great show planned for you today. We have the illustrious Dr. Hodge here to talk to us about sickle cell and medical marijuana. So glad you guys are here to tune in.
And thanks for having me. It's my absolute pleasure to get on and talk about medicinal cannabis and its efficacy and how it can help the whole sickle cell population, especially the caregivers, you know.
Oh, yes, all of us need it. So I can't wait to dive into it.
Yeah.
But I do want to start with this clip that I got that you just went on this tangent for Sickle Cell Awareness Month. I want to show people how passionate you are, not just about sickle cell, but also about medical marijuana. So let's take a look at this clip.
You caught me. Let's see it.
Yep.
Let's see it.
So I put that story about that young lady, and I hope you're feeling better. The one that was in UK that decided to amputate her right leg that was experiencing CRPS. And physicians know CRPS as the suicide pain. And it gets a lot of attention, and sickle cell does not. When sickle cell warriors experience CRPS at 3 months of age. And this is September. September is sickle cell month. So I read the article and I was like, yeah, but damn, my sickle cell warriors are experiencing CRPS like on the daily, and they go pick up their prescriptions. These technicians judge them, right? They go to they have a pain crisis. They're living in pain. They have a pain crisis, and their pain, I'm talking that stupid scale 1 to 10, they're living at about 1,000. And this is how mad I am. And so when their pain spikes, they go to the ER, and because they look, you know, they can't see the pain. A lot of people think they are malingering, making this stuff up just to get opioids. And it just pisses me off because the caregiver, the patient now distrust doctors. They distrust the system. They feel like they're being judged, and it makes them feel this small, you know. And on top of chronic pain, that they have suicide, if CRPS, if 70% of those patients feel like they want to kill themselves, now imagine what my sickle cell population is going through. They have the same pain. Plus they're being judged. They feel so alone. Life expectancy at 40, and nobody gives a shit. Yeah, it pisses me off. That's all. That's all I got to say. It's just a rant, but just pissed, man. So my sickle cell warriors, man, put some respect on their name, man. Put some respect on their name. They go through it. At 3 months of age is their first pain crisis. They're getting opioids. They're getting fentanyl. Yeah, little babies. Yeah, they're having strokes and heart attacks and losing sight and losing their spleens in their teenage years. Yeah. All right. That's all. It's just a rant. Sickle Cell Awareness Month. That's it.
Well, that was a mouthful, Dr. Hodge.
Yes, it was.
Yeah.
my first question is, what is it about sickle cell that makes you so passionate? Like, where did you get this passion about the Sickle Cell Awareness Month?
Well, one, I sit on the board of the Sickle Cell Foundation here in Georgia. So they're near and dear to my heart. And I experienced chronic pain myself. So I didn't unfortunately, I understood it like textbook, but I didn't know I didn't have any empathy towards the sickle cell um, population, nor did I know the incredible strength the caregivers have to care for their sickle cell babies, sons, daughters, right? So, yeah, from dealing with my chronic pain when I broke my neck in 2012, um, trying to get a hold of my depression when I have my nerve pain and it kind of, you're a population that kind of understood what I was going through and vice versa. So, this is a point in my life where you and I, we need each other. You understand where I'm coming from. You understand that there is no feel better for me that I experience chronic pain for the rest of my life. And it's something, it's to communicate as human. So, you and I, we can communicate and it's nice to be heard.
Yeah.
In a nutshell, that's all it is.
Absolutely.
Yeah.
And I think you summed up that well as far as what we deal with pain and just everything else that just we deal with and how to cope with it and continue to live a fulfilling life with the pain that we have to deal with. So I thought that was really, really good. Do you think that sometimes doctors try to mask the pain with opioids instead of like getting to the root cause of what's causing the pain?
Well, the doctors, when we go through med school, there's just going to be a gold standard of treatment. So as physicians, you come in, we take a history and, we see that you have sickle cell. The gold standard is IV fluids and opioids. So we're just following textbook, physicians, until you get hurt, until you get on disability or take care of a mom and dad and you see how this healthcare system is a business, you are just a sales agent, you don't know. So until I broke my neck, yeah, you come into my ER, I'm going to give you opioids. It's just,
Yeah.
it is what it is. We learn disease, then what is the gold standard of treatment? What is the rest of the world first choice? And it's opioids. We didn't know about medicinal cannabis. We don't know about comprehensive health care because, once you get the diagnosis of sickle cell, treating the pain with an opioid is one thing, but what about the depression? What about the anxiety?
Yeah.
What about the support system? This word comprehensive health care is really needed for a disease like sickle cell disease. You need physical therapy. There'll be hospitalizations. You're going to need rehab. There should be a well-planned skilled nursing facilities if you do have a stroke, and it should be just well, you shouldn't have to be a guessing game and that's too much frustration when you're fighting for your life.
Agreed.
Yeah.
Agree with that.
Yeah.
And what would you say in your experience has been like the biggest hurdle to getting medical marijuana more widely accepted as a treatment for people with sickle cell?
I would say it would be the caretakers. I'm sure the patients, my patients are willing. The opioids are not helping them. We all know, the CDC knows. Now Trump says it's a big epidemic. After 3 days of taking the opioid, you're going to be tolerant. So those 3 pills, you need 9 pills. But
Right.
where are you going to get 9 pills? And you're not going to die from them either because you have tolerance.
Right.
You don't have to, you're not a population that has to worry about carrying an EpiPen when you're taking opioids since 3 months. I mean, not an EpiPen,
Narcan.
Narco.
Narcan. You guys know that because
Yeah.
yeah. So that's where we're at. Kind of lost my train of thought with that. What would you ask me?
What's the biggest hurdle that you found?
the biggest hurdle is physicians. So 14% of physicians recognize cannabis as medicine. The other 86% still call it a Schedule I drug because cannabis is still a Controlled I substance. It's still up there with heroin and cocaine. Although 34 states have interpreted federal law and called it medicine. And we have called it medicine here in Georgia since 2015 for sickle cell disease. So because of my constituents, and it's because of their ignorance, and some of it is they're being cowards. They're just following this gold standard,
So what's the difference between the medical marijuana and something we can just go get from the weed man? Like, what's the difference?
It's all the same, A lot of the because of the taxes, a lot of the weed man the cannabis that's coming on the streets comes from dispensaries.
Okay.
Really, backdoor from dispensaries. So a lot of the weed that's here in Georgia comes from California. California used to supply 2/3 of the world, their black market. Oh yeah. So difference between this is this has a certificate of analysis that's called a COA. So for my medical community, Parkinson's, sickle cell, cancer, hospice, any Crohn's disease, you and we're taking this every day, sometimes 3 times a day as medicine. We're not weekend warriors. We're not doing this on Friday nights, So
right.
Our cannabis oil has to be pesticide free. We need to know the antibodies that are made. We didn't know if there are heavy metals, RPGs in there, because if those poisons can accelerate our disease, accelerate our conditions, So we have to make sure our cannabis is clean. So medicinal cannabis is cleaner, and it's usually stronger too. It could be stronger.
So for those who don't know, the difference between sativa or indica, does it matter what you take? For sickle cell, is one better than the other? Should people know exactly, is it like say I take a certain amount of opioids, should I take, sativa instead of indica if I have certain issues?
It's a great question. So medicine has taught us, tried to persuade us for their business. For their $1 trillion business, they try to say one size fits all. So when you take a Percocet, when I take a Percocet, you and I are going to have the same reaction, the same benefit. We're going to pass it. You and I are going to have a little bit of constipation. It's not going to affect our mood. So they think that it's one size fits all. They tried to sell that, and they sold it for decades. We know that everyone is different. So cannabis, there's a sativa, and then there's also an indica. But most cannabis now, smokable form, they're hybrid. So what you have to pay attention for as far as caretaker. So when you guys get your cannabis card, when you walk into a dispensary, the flower, if you get a pre-roll, or if you get an oil, or if you get candy, edibles, it's going to have a ratio of CBD to THC. So you have to pay attention of your ratio. So ratios start from 20-1, 20 CBD to THC to 1-3. So you need to know what works for your body. Everyone is different. It depends on what you eat, your makeup, gender, body fat. Everyone is different. So once you find out what ratio works for you, then you got to try all delivery methods. You need to use oil, sublingual, tinctures, edibles. You might want to inhale. You want to vape. You want to use topicals. You want to use patches. You want to use suppositories. So there's 5 different delivery methods of this great adaptogenic herb. So once you figure out what is optimal for you, what is most efficacious for you, then go for it. But you got to try it all,
Okay.
There's a bunch of delivery methods,
I love it. That actually leads into the next question where I was thinking about, what would be the best way to consume it for, and like you said, it's for different people. Some people have lung issues so that they can't smoke it, so maybe the edible is better, or the CBD topical form is better for them. So that just led into the next question of the best way to consume it.
That's the best. And it's for me, my favorite is inhalation. So as this cannabis becomes mainstream, and for our caretakers, you don't want to say, hey man, you don't want to say, hey son, smoke this. You're going to say, hey, you need to inhale, take your medication, let's inhale. We're going to vape. Vaping doesn't create any smoke, so there's no tar associated with it. But if you smoke, I like to smoke, I like to inhale, because I can pull to effect a couple inhalations. Cannabinoids, my flavonoids, my terpenoids are going to cross my blood-brain barrier, and I can pull to effect when I can put it down when my pain goes from a 12 to an 8.
Right.
Sometimes when you take an edible, you got to wait a half hour, and sometimes that thing can take you on a ride that you don't want to be on for that long. You see what I'm saying? Right. It is not as predictable. So doctors, we like to be able to give medication that's very predictable. Okay. I don't want to say, hey, you chew this, you might be stuck for 2 days, you might be good for 1 day, you might be in the bed. No, I want to say, hey man, you might want to, the half-life of inhalation is 3 hours. So if you have the ability to inhale every 3 hours, waking hours, go for it. Okay. This can last up to 2 days. You guys know about this oil, how potent it is. Yeah. This can couple to your CB1 receptors for 2 days. Yeah. You can have your endocannabinoid system activated for 48 hours, and people can't handle that. They freak out.
Wow.
You know that.
Yeah.
So there's a lot of teaching when we do it, but the main thing is the main thing: 0 deaths. 0 deaths with cannabis.
That's the best part. That's the part.
No other drug can say that. No other drug can brag about that. Johnson & Johnson, Eli Lilly, they can't brag about 0 deaths.
Right. Now, what would you say to those people who are concerned about the whole vaping issue, especially when it was going around in the news, how it's killing people, and just what can you say to ease the minds of people who are concerned about vaping?
Okay, one thing about news, somebody's paying for that. So I'm going to ask you, what giant has been hurt by cannabis? Big pharma, big alcohol, big tobacco. They pay for shit like that. Now, and have you heard of any vaping related illnesses since Corona?
Nope.
No.
Corona.
Maybe it was Corona. And they want to blame it, on vapes. Because vaping has been going on for 20 years. And then from the last year, you started hearing about injuries.
Yeah, like hearing about the lung issues and vaping, which would make people afraid. Like, especially like someone like me who I have pulmonary hypertension also. I'm like, what does that mean that I shouldn't vape? Does that mean, something that was working for me previously is now more harmful for me than I thought it was initially?
See, it was helping you, right? And,
yes.
It's helping millions and millions of Americans. And it's helping the millions and millions of people around the globe. They're using cannabis for most of their medicinal ailments and diseases. Big Pharma wants to keep you a customer. So you decide, hey, I'm going to be a boss. I'm going to be this customer.
So do you think that, like, if you're using medical marijuana to treat your sickle cell or your chronic pain issues, that you can eventually get to the point where you don't require the prescribed opioids?
Absolutely. We can get on if we can start earlier, once someone has a diagnosis of sickle cell disease, and before you do years of conscious sedation, in your pediatric life, that sucks too, because, the sickle cell population associates pain relief with opioids, plus I need to be asleep.
Right.
Now, once you become adult, we can't do that for you. You know, we're gonna give you some prescriptions, but emotionally and mentally, you know, that's part of your pain relief. That's part of your prescription is, hey, I need to be sleep. So, you know, once we have a baby, you know, before the baby's first crisis, they start taking some oil, you know, you put on their gums. They don't have to have teeth, you know, they don't have to protect their airway because the medicine is going to be delivered, you know, through the sublingual vein. Right. So you get that endocannabinoid system activated, and hopefully those crises are maybe one or two every 5 years, and those hospital readmissions are just maybe one hospital admission a year.
Yeah.
Versus that readmission, you know. And if you're in the hospital, just to make sure you don't have like pneumonia.
Right.
Yeah. So you're gonna, you know, hopefully, you know, caretakers, you know, especially now, generation, 45. I know I'm generation X. So if I had a child, you know, he or she would be eating it. You know, I would be making cannabis butter. So their diet consists of cannabis. They would be taking oil. If they needed to vape, sure. You know, if I had to pull them off of school to give them a J, I would do that. You know, and say, hey, go back to school. So cannabis is preventative too. So prevention is always better than cure. I don't care how you want to add it up. And, you know, the myriad of your problems, you know, flu can kill you. Corona can kill you, you know. Blood sugar get out of whack, it can kill you. You know what I'm saying? So
Right.
you want to try to prevent the smallest, the littlest shit, you know, that most people can withstand. So,
Right.
yeah.
I completely agree with the preventative side of things. I think I
Stress will kill you. Y'all are stressed out.
Yes.
And it's so like
Caretakers
sickle
are
cell care
stressed
is so
out.
reactive.
Yeah.
Is reactive. Like we're never being proactive. Like your doctors are never being proactive. They're always being reactive. Like, oh, this happened. Now let's see what else. But how can we get to the point of this not happening? Like in the first place.
Right.
Understood.
Reactive.
Understood. The reactive is the business of medicine, you know.
That's
Is to give you a pill, and then that pill is going to cause you to have two more pills and more symptoms and more negative and some positive outcomes. I'm going to treat some more of those negative outcomes with or side effects, you know. And hopefully, and maybe one day my nephrologist buddy will have a dialysis machine chair waiting for you 3 days a week, you know. And maybe my pulmonologist buddy will have whatever for you. We all need to go on vacation. We want to buy our BMWs and Mercedes, you know. So the best thing we can do is don't trust them anymore, you know, become your own physician. So only time you need to see a doctor, you break a bone or orthopedic, you know, you can't put plates and screws back in your arm by yourself. But other than that, you're taking your cannabis oil, you're doing your meditation, you're exercising. Diet is, you know, your food is your medicine. You know, you're practicing mindfulness, your sleep hygiene is A1. So you're doing everything, you know, you hold yourself accountable because, you know, you thinking this pill is keeping you alive.
And it's slowly killing us.
Yeah.
It's
or you thinking that really,
there.
you know, you gotta fight hard to get a hold of your depression every day. Someone's got to teach you those skills. Someone's got to teach you the skills to keep you in the present so you don't worry about, man, you might have just left a funeral of someone that was 24 years of age that you grew up with. That causes some anxiety, like shit, you know, like, damn, you know, I might be next. So this will kind of keep you know, you need those coping skills, and you have to really get to acceptance, you know, with a lot of stuff where most, you know, you have every right to be angry about a lot of things, you know, but that's going to kill you too.
Yeah.
Yeah.
And I think on a certain level, I've learned to embrace having sickle cell, and embracing it is how I fight it in a sense. It's how I stay on the proactive side. So I do a ton of things that keeps my stress level low, whether it's arts and craft, whether it's smoking a little something, whether it's music, dancing, whatever. But I try to incorporate as many of those things as possible to keep my stress level low, because stress is one of our triggers. And
Right.
the hospital is the worst place to go right now, especially with everything going on. So it's forced, this whole pandemic thing is forcing us to be our own doctors, like you said. Is something that we've been promoting anyway, but this time is really forcing us to take care of our stuff at home, to make sure we use exhausted all type of methods that we can at home before even going to the hospital, because you worse off there than you are at home at this point.
Really?
Correct. And I applaud you. You know, you talked about music therapy. You just talked about art therapy, even coloring, you know, that's mindfulness. So that was the old medicine we used. We used the earth, we used, you know, flowers, we used herbs, we did some dance, we did some music therapy, you know, we did some Reiki. That was it. So essentially that holistic vibe that you're doing, that's where we all needed to be from the very beginning. But there's a business of medicine. So you're doing the right thing. Elderberry, your black seed oil. You follow me? You're doing the right thing. Dancing, music therapy, smiling, that produces that negative hormone cortisol. Cortisol is the reason why heart disease is the #1 killer in the world. Cortisol is why we have cancer. Cortisol is the hypertension, the diabetes. Cortisol is your trigger as well. So we're all susceptible to the stress hormone, that killer cortisol, but that definitely will send you into a tailspin,
Yeah.
Yeah. So mitigating and managing stress is important for everyone, everyone, especially you.
Yeah, I agree.
So, like, if you have, like, for instance, my physician is not, I don't want to say anything bad about her, but she's not as present as I would like for her to be. And it's kind of difficult to find a lot of sickle cell doctors who are like really in it because they are passionate about sickle cell. And when you bring up like alternative treatments and things like that, they're not as open, or they are not as aware of alternative things that you can do. So how would you suggest that, like, if I wanted to delve into the medical marijuana, like, how would I approach my physician, who may not really be as open-minded?
Well, you're gonna say, hey, hey, Dr. Jones, let's say Dr. Jones, or have you signed up to make medical cannabis recommendations? And I'll tell you right then and there that doc, no, he's not with it. He's not with the shits. So therefore, you can say, hey, look, I'll go to you, because it's your choice.
Right.
It's your choice. You can fire your doctor at any time. And if your doctor, if you feel like you can't communicate with your physician, that means you're not telling him or her everything that's on your mind. You're still going to walk away with a lot of pain. And the pain of just not being heard is probably worse than that sickle cell crisis at this point in your life.
Yeah, it's frustrating.
Yeah, the frustration. So if he or she is not present, if you say, hey man, you can do a consult telemedicine appointment with Dr. Hodge, with me, and you still can see your own, your sickle cell doctor. Get a doctor that understands holistic health. But most physicians that are practicing never been injured. Because if they were injured, they'd be on that word disability, right?
Yeah.
And they won't be practicing medicine anymore. I just happen to be, I'm rare with me, because we're all rare, but I'm rare because I was on disability for 2 years. I wasn't working. And I got on my oil and I got back to work. And now I get to tell my truth. But most doctors, they don't take cannabis. They're in the closet. They're in the green closet. They smoke recreational, Mardi Gras, New Year's Eve, They'll never admit it, but they're in the closet. They'll never talk about it, they're cowards. So, you got to get you some truth tellers, because if you follow people that are just for the business, or unfortunately, they don't know that they're sales agents. And if that doctor doesn't know that they're a sales agent, they're going to hurt you.
Yeah.
They're going to harm you unintentionally because they're practicing medicine not from empirical evidence. They're not saying, I'm putting that hydroxyurea in my mouth, I'm putting that Roxy in my mouth. That's what empirical evidence is. What do you put in your mouth that helps you and then suggest it?
Exactly.
Right.
You see what I'm saying?
Right.
Yeah. I mean, don't tell me about Italy if you've never been to
Right.
Italy.
Right.
You feel me?
Agreed.
Right.
Yeah.
And they approve a lot of these medicines for us to take, but I doubt
So
they can handle like one or two.
most of them doctors never took the shit.
Yeah.
Name one oncologist that took the chemotherapy that they prescribe every day.
Right. Now, my former physician, he ended up getting cancer, and I felt like, I mean, this is weird, but I felt like he became a better doctor when he was going through, fighting cancer, because when I came to him, he was so empathetic. He was so understanding. He was like, well, what do you think you need? Tell me what you think I should do, because it's your body. And we had such a great relationship. And, God rest his soul, he passed away. And now I'm stuck with like this new lady who is like, has the personality of a wall. And I'm like, this is terrible.
Yeah. They're not going to feel better. You got to fire her, and you got to find you a new position. I know it's pretty arduous to go through and find a rapport, someone you vibe with, but you're obviously not vibing with her, and they're going to hurt you. The stress is going to hurt you. You going into a waiting room to hear bullshit, you're putting yourself at risk going into a waiting room because of the germs. And then you just heard bullshit.
Yeah.
Right? It's
Yeah.
Right.
Dude, I put myself at risk to sit here, to hurry up and wait and look. See. Fire him. It's your choice. It's your choice.
And it's difficult to find a sickle cell doctor here in the Atlanta area as well. So yeah, sometimes we have our hands tied of who
to go to.
Yeah.
Well, that's why your nonprofit is necessary. One is because you're surviving a disease. Everyone has a mortality. We're all going to die, but you're going through this arduous process of everyday dealing and surviving and coping with disease. So before there was a medical school, there was a word called a shaman. The person that went to hunt and 6 hunters and 5, one person comes back with a tooth. They're like, man, you the shaman. He just survived some ill shit, right? So your knowledge, your wisdom is the nucleus of the village, like the old back in the day. So your information, your nonprofit is going to give more caregivers and more patients and build a sickle cell community where the referrals are easy. So there'll be less frustrations,
That's the goal.
That's the goal.
Yeah.
That's definitely one of the goals.
Yeah, it'll be less frustrations from caretakers to, hey, not 911s, but hey, man, my baby's having a fever. I need someone to watch the other kids, babysitter, nanny service, driving service. And then, a lot of people can't work. So maybe you guys can exchange talents, not always exchange currency. So the sickle cell community can start exchanging money, support one another, and that's some economics too.
Yeah, that's also one of my goals, because the community has a lot of talented artists, or it's a lot of talented people from people.
Period.
People that rap, people that write, people that act.
You have a community, a real community, and then that can, once you guys support one another frequently and not just one time, right. It'll be a very wealthy community because y'all don't really trust anybody. No one's really fucking with y'all, they're not. It's 2020.
Yeah, keep it real.
Yeah.
Nobody gives a damn still. So
we're gonna make them give a damn.
Yeah, we will. But I'm just saying, there's people that do more. More of this is needed. More of this is needed. They don't know people with sickle cell. They don't.
Right. And they don't know enough about it to like actually care. So you get somebody like, hey, listen, let me pull you aside. This is what it is.
Yeah. And I tell people, especially in the community that's not involved in anything and that feel alone, once you get out and start doing things with your local sickle cell community,
You feel the love.
you'll feel the
Of
love.
course.
You'll
That's
see
why the
it's
community is
like,
awesome. I mean, the tribe is important, you know. That's why I go so hard because you know, so many of in the sickle cell community have been beaten down. So I kind of just want to see y'all, uplift you all, uplift the caregivers, uplift the givers, the patients. Just want to do my part, man, to spread some empathy and let you know there's physicians out there that really, really vibing with y'all. They're rooting for y'all, that want you to thrive, that we want you to have a cure, We want your quality of life to be just like the next person, you know?
Right.
Yeah.
And we want you to use cannabis too every day.
I'm okay with that. So let me ask you, since you suggest cannabis every day, do you still think that people need to go by their prescription meds until the doctor takes them off? Or how do we balance the cannabis with our prescription meds?
Yeah. So once you get your great question. Once you get your medical cannabis recommendation, you want to start weaning. So once you have product in your hand, you want to start using your cannabis product that as recommended, So for sickle cell, I might say, hey, take a rice-sized granule on your finger and do that in the morning and 2 hours for bedtime. But at the same time, you're going to start taking your Percocet, get a pill cutter, and you're going to start shaving a tiny little piece off that Percocet, off that Roxy. If you're taking it 4 times a day, you're going to shave a tiny piece for the first week. Second week, you're going to shave a bigger piece 4 times a day because your brain is used to it.
Yeah.
And it will make you incredibly sick. And a lot of patients, have been sick before, and they don't know about their opioids, So that would help with the physical dependence. That would help with some of those symptoms, the withdrawal. It is withdrawal,
Yeah.
attitude, feeling like shit, can't get out of bed. It can mimic a sickle cell crisis.
Yeah.
Yeah.
Because your brain's like, hey, what's the fastest way to get IV? Let me get into the ER. You know what I'm saying? And your brain is your command center. It will trick you. So once you get the cannabis, we'll talk about the cannabis oil, but we'll also talk about, hey, you're gonna have some opioid withdrawal. You're gonna feel a little crummy. How's your support system? What's your tribe like? What's your village like at home? Again, this is comprehensive care, which is needed in the sickle cell community. What's your plan for exercise? What's your plan for mindfulness? Because these opioids are very distracting, and your brain will make you focus on the reward of receiving it again. So by week 3, you're shaving another piece. By week 4, you're shaving an even tiny piece. By week 5, instead of 4 times a day, you're doing it every 8 hours, Q 8 hours. Week 6, you're doing a Q 12 hours. Week 7, you're just doing a QHS at nighttime. And by 2 months, you're done.
Okay. And are you increasing the cannabis oil as you wean off of the?
Yeah, you're gonna get it more. You're gonna increase because you're gonna get a tolerance with this. So you can start going 3 times a day. And if same thing for benzodiazepines, if you're taking Xanax or Ambien to help you with insomnia. A lot of people, with chronic pain have insomnia. I mean, I struggled with insomnia, but it took me 6 months to get off the Ambien.
Oh, wow.
And I knew what I was doing, It took me 6 months. Benzodiazepines have a strong hold of you,
Wow.
That's my truth, That's my truth. It took me 6 months. There's some people that can't get off of benzos. Some people can just stop day one, cold turkey.
Yeah. I think for me, cannabis works best, especially when I've come home from the hospital and dealing with the decline off of all those medicines at the hospital. That's when I can smoke something and I got my energy back. I'm able to eat something again. I'm not nauseous, and it works best for me then. What would you say to people? Because a lot of people with sickle cell are also on disability. So what would you say to those people? I can't afford it every week, or I can't afford it. I just don't have the money.
Yeah, because unfortunately, cannabis is still a Schedule 1 drug, so there's no insurance companies, there's no banks, right? So we have to use our post-tax dollars. So what's needed is your foundation needs to tap into other foundations or raise money because I'm trying to do the same thing, like a little bridge for families and caregivers and patients that can't afford it. So you would say, hey, look, for like an indigent fund or something you want to call it, you can start say, car wash or whatever way to start collecting money and maybe get a fund and you can start helping people that need it get medicine. You can also start contacting some of these like Aurora Cannabis, these True Live, Florida. There's companies here in Georgia that are emerging. So these companies that are emerged that are going to apply for licenses here to grow in Georgia, they have to do a contract. They got to do business with a nonprofit. Some of those proceeds have to go to the community, especially the community that's been affected by this failed drug war, especially by the community that can need it the most, and that's been in prison, that's been incarcerated behind it. So yeah, you say, hey, I'm one of these nonprofits that you gotta do business with, you know, and you start getting their trim. You can start calling and getting free CBD isolate, free CBD distillate. Let them know, look, I'm so and so SCA, sickle cell. You heard about it. What can you give me for free? We
Okay.
got patients that are dying. Explain it to them, and you start getting stuff. You start getting vape pen donations, and you can start passing them out.
I
That's
love
what
that.
that's what I would suggest.
I love that suggestion. I'm definitely gonna look into that as soon as we hang up because I think that's what's holding a lot of people up, and
Yeah.
we really want to support well-rounded wellness, more
Right,
disease management and not pain
right.
management, and just
Mhm.
like you said, mindfulness and just the whole shebang.
Yeah,
Um,
food, diet, mindfulness, exercise, music therapy, art therapy. The last thing we're thinking about is big pharma. We got to kind of
Right.
just. The only way to change the narrative is to really comprehensive. It's got to be all of that, and it's going to work. It's going to work for sure.
it is. We're gonna keep pushing it. Our
Mhm.
hashtag is no days off, so we're gonna put that in Sickle Cell Awareness 365. We
Yeah,
don't
it's no
stop.
yeah, yeah, no days off. So your
Especially the fact
nonprofit is
that,
very important, very important.
yeah, especially the fact that you said they have to support us in the community because of the drug wars that were raged in our community. I never even thought about it that way.
Oh, it's in the law. So if I went to some of the Joint Commission study meetings in the George. Well, there's a committee that's all these vendors that want to start growing cannabis here in our state. So when they get on that podium, they're like, okay, you're gonna have to hook up with a nonprofit to even do business here. We're making sure when we do cannabis here in Georgia, when we start our legal access, that you have to couple with nonprofits.
I like.
So you should identify the front runners, and you'll know. It's like True Live. It's we got a big one, Sotera Wellness, and you start calling them like, look, man, who's your relations department? Boom. I know you guys are going to be you might win one of the large licenses to grow cannabis here. We're a nonprofit and we're in this community. We want to talk, stuff like that.
Yeah.
And then you call all around the country, all these companies in the legal area, CBD companies, get distillate, get vapes, get gummies. They'll send you test stuff, they'll send you vape batteries. All that will add up. They all add up. So get them for free, you know. They
Yeah.
might send you some grinders. Um, they'll give you lighters. But that's all post-tax dollars, paper. It's all adds up. It all adds up.
I,
And
so do you think Georgia is headed to legalizing marijuana all around? And
uh,
much longer do you think it'll be?
well, I think the country is headed to legalization. So Georgia won't legalize until the country, until the feds say, hey, this is no longer a Schedule One drug. We're going to legalize adult sales. We're going to regulate like beer over 21. Um, and then Georgia say, sure. But until then, it's just going to be the medical, and we're medical. So
Do you find that like there's more of a stigma with sickle cell patients using medical marijuana than like any other diagnosis of patients using medical marijuana?
No, the number one reason that this country uses medical marijuana is for pain. So it could be fibromyalgia, it could be from osteoarthritis, it could be from me having, it could be me having, a broken neck or sickle cell or Crohn's pain. Pain is pain. But then there's emotional pain. There's, emotional trauma where cannabis can help, which sickle cell population, suffers from too. So yeah, this, you guys are real easy to say, hey man, obviously you need cannabis. Your life is chronic pain, sure. So no stigma at all.
Okay.
No stigma at all. There's a stigma, with the opioids, of course, but this is cannabis, and I wish you can unlearn and unremember all those bad incidents that you've been through as far as the healthcare system interactions. But with cannabis, you're gonna take it home with you. You're gonna be your own doctor, and you're gonna learn comprehensive healthcare, comprehensive mindfulness, exercising, farm to table, foods that are going to lower inflammation. How can I, stuff like that.
Yeah, good.
Yeah.
So how can we get a medical marijuana card here?
You took the question out my mouth.
Easy. PremierCPC.com. PremierCPC.com. I have telemedicine appointments, so where this is the new norm, Zoom and consults. So we can do it just like this. We'll do you'll email, you'll get your records to me digitally, and then we'll do a telemedicine appointment. You go pick up your card, and you're allowed to carry 20 ounces of cannabis oil for 2 years. We'll have dispensaries by January, February. You'll go buy your oil there. Until then, you got to meet people. And then easy.
Well, we ready.
Easy.
We are ready.
And in Georgia, there's a caregiver card too, so you don't have to be 18. You can have a 2-month-old, 3-month-old. Get your baby on cannabis.
Oh wow,
okay, that's good to know.
That's really good.
So we have a patient card and there's a caregiver card. Let's get the babies on cannabis ASAP. Let's get the young kings and queens on cannabis ASAP.
I agree with that.
Because starting them off earlier will help eliminate the opioid issue with your organ failure and all that kind of stuff, like down the road.
Yeah,
it's a cumulative. It's going to be an effect. Some kidneys will be able to hold up, but there'll be some kidneys that you just can't get all that gunk out of their system, and you're going to be on dialysis. You're going to have chronic kidney disease in your teenagers, in your 20s. There's going to, some of those pills are going to cause severe colitis. People are going to have stomach pain all the time, and it's always nauseous, and always sick. That's from polypharmacy, years of abuse,
Yeah.
So this is something natural. You have a natural endocannabis. You have natural receptors for this cannabis. So it's starting out early is amazing. You're going to use less opioids, and you're going to feel more in the present. So that means you get to enjoy your childhood more. That means you're with your friends more. It means you don't feel less like shit, man. If I go play kickball, I might have an attack, and they might tease me, and that's it for kickball. I'm never doing that again.
Right.
And those traumas that develop as you're young and then going into your adulthood.
Yeah. But the village needs to address that. You guys need to address and help young soldiers cope with emotional trauma. You got to help them get to acceptance. You can't let them be angry from kindergarten. That anger is going to turn into a huge onion that's going to kill them. So, getting to the acceptance and understanding, how this disease can affect your ego is very, 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 very vital.
Yeah.
Because that's going to affect his or her self-concept of how they feel about themselves.
You're right. And we do work closely with the Sickle Cell Foundation with their Ready, Set, Transition workshops. So it is workshops from the age of 13 to 18, their parents and young adults between 19 and 25. And it's 6 different workshops that we do with them every other month. We kind of have to switch it up now that all this is going on.
Right.
But we did start that back in August. So we do work closely with that transition age, just teaching them different aspects, like you saying, dealing with learning how to cope with different things and how to build your self-esteem with this disease, and just all around aspects into going into adulthood with sickle cell disease. So we love that relationship that we have with them and doing those workshops.
That's hard. That's dope. You know, and if you can start at a younger age, it'd be even better. You know.
Yeah.
So
That.
I applaud you for that. Definitely super important. Self-concept will get you through a lot of shit.
Yeah.
You know.
Yeah.
So, because unfortunately, you know, the sickle cell community will still be judged.
Right.
You're still going to be judged. You know, and if your self-concept is strong, and if you guys work on these workshops and exercises, they'll be able to handle a lot more, because we can't prevent it until there's a cure. You're gonna lose friends. You're gonna have the PTSD. You're gonna have the severe adjustment disorder. You know, you're gonna be embarrassed. You're gonna, but you shouldn't feel embarrassed if your self-concept was there. There would be no embarrassed. There would be no regret. There would be no anger. You see what I'm saying?
I agree.
Right.
I completely agree with that.
Yeah.
So I want to thank you so much. Let's thank
All right.
sponsors really quick.
Okay.
Our sponsors were Apex Museum.
Apex Museum, that's dope.
Yes, we love more over at the Apex Museum. That's one of our sponsors. Another sponsor is Kids Stop Daycare and Learning Center. Miss Tanya Robinson, who's been a great supporter for us.
Bless up, Miss Robinson.
Our newest sponsor is Black Professionals Network. We just went there in North Carolina and did an event with them back in late February. So yeah, we want to thank Black Professional Network. And Jennifer.
And yeah, we're just gonna always be looking for new sponsors. So if you watch and you listen, and this is something that you want to be into the cause with us, just contact us, let us know. Cool. And thank you so much, Dr. Hodge. We really, really appreciate everything that you've told us, all the education you've given us. You've opened my eyes, and I'm sure you've opened Mia's eyes to some things that we didn't know. So we really appreciate you taking time out and coming and being with us today.
Queens, it was my pleasure. Thanks for having me on. I'm a blaze one, so it is what it is, right?
I understand. We'll talk to you soon once we make those appointments to get our medical marijuana card.
All right, y'all take care.
All right. Thank you so much. Bye, y'all. Y'all have a great day. We'll see you in a couple weeks.
All right, great. Have a great evening.
Bye-bye.
All right.